y'all. I'm Julie St. John. I may or may not know some of y'all. I currently work for Texas Tech Health Sciences Center in their School of Population and Public Health, and have been in the CHW world for, I don't know, a couple of decades now. Not maybe as long as some and longer than others. So I really believe in the community health worker model, and I really see my role as a researcher and academician as how I can help support that role model, making sure that the work that involves CHWs is accurately reported and represented, and to really help move the profession forward. So it's really an honor and pleasure to be here to talk about this topic today. So thanks. So I don't have any slides. So I was just going to kind of talk through the survey, as Rosalie mentioned, that we did. So here's a little bit of background information. So kind of the pandemic started and everyone started, shutting down in March of 2020. There is a researcher, some of y'all may know her, but Dr. Courtney Bird Williams, she's at UT Health out of the Austin campus, had reached out to myself and some others that have been involved in CHW world quite a while, particularly Lee Rosenthal, who helped lead the National Core Consensus Project. Y'all have heard that, the C3 project, which provides a framework for roles and skills. And that work has been ongoing. And anyways, Courtney had reached out to us and said, we really would like to do a survey among CHWs to kind of ascertain, what's going on, what are the needs, what are the, just what's going on, and how can we help support CHWs in this time. So there's 3 different institutions involved. And as you can imagine, trying to go through IRBs, it did take us a little while to get through all the organization of the survey and approvals, but we launched that towards the end of summer of 2020, end of July, I believe, and had it open for a little bit and started looking at the data. Actually, it took us a little while longer to get all that launched, but we did launch it and then wrote up a report, and we had these initial findings. And we asked a lot of questions. Gen 1, we wanted to know how are CHWs doing during the pandemic, because we are very concerned, just about everyone, but particularly in the roles that CHWs fill. And then we wanted to know, we were also interested in what has changed for you all. Are you doing more of some things than others? So we particularly looked at those roles and skills. And then we also asked, what training do you need? What did you have access to? What might you still need? And so that was kind of the overall survey. And there is a report, and I'll put it in the chat here in a little bit, from round 1. Well, then of course we've had subsequent kind of uptakes of the COVID pandemic that's kind of resurged. And so we decided, well, maybe we should do another round of the survey. And so it took us a little while to get all that through, but in the spring, end of January, February, early spring, we were able to launch a second round where we added information specific to emergency preparedness, Rosalia, which was really nice. And so I'll be able to talk about that a little bit. But again, what we was, how are CHWs doing, and then what are some of those needs? And the first survey, we had a response, close to 900 responses. And I'll tell you that we did do Texas, New Mexico, and Arizona. We did not have a great response from the other 2 states. And then as we made the survey instruments available, additional states have conducted this same survey. Oklahoma had some data, and then other states have also just said that they're areas that are looking at trying to do this. And so we had that original data. From that, by and large, from that survey, the CHWs told us, yes, we absolutely need more training. And so as far as what they needed, I'm going to read some of those particular areas. So in round 1, they told us we need information on just prevention. And granted, this is very COVID related specific. So we're talking 6 months into the pandemic, we need information about prevention, testing, treatment, symptoms, mental health. Mental health really came up early and often, and pretty much what we would expect with anything that's new. So they said, yes, we need training, and this is what we need. Roles and skills, we asked pre and post, kind of pre-COVID, and then now since COVID, what has changed? And it was nothing that probably surprised us too much, right? So a lot of people said, we're doing some of the same things, but how we do it is differently, right? So we're no longer going door to door to do a lot of these things, or in clinics. A lot of what we're doing is through online formats or phone calls and things like that. One thing that I was found really, really interesting to me is what the skills and qualities. And so I just wanted to touch on that very briefly. These are things that are kind of inherent traits of community health workers. And these are ones from the original 2007 workforce study. We just used those and we asked community health workers, hey, where are you feeling on these? And what I want to point out is that they do all of them, right? But one that moved way up on the list, there's 10 of them, and we asked them to rank pre and since COVID started. What are those skills that you really need as a community health worker? And this is why I think it's important when we talk about preparedness. Being courageous moved from 10 to 6, which is a pretty significant jump. And so I think that's important when we talk about preparedness and emergency preparedness. Are we helping equip community health workers in that realm? And then the other one that jumped quite a bit was resourcefulness, which jumped 3 spots to number 3. Number 1, being connected to the community you serve, that stayed number 1 before COVID, and since COVID, we would expect that. And then being honest was the other one that stayed. The rest shifted just a little bit, but just I think that's really important as we think about CHWs and their roles in emergency preparedness. I'm not going to say much more than that. I will say briefly what we're finding in round 2, which we just closed and now are analyzing the data for that. We asked questions, but we added questions specifically about emergency preparedness. And what I thought, everyone said, yes, absolutely, CHW should be involved. And then they added comments why, but there were a few concerns that were listed, and these are CHWs that took the survey, and they just said we need to be careful not to change the scope of what community health workers do. So I think that's important. But by and large, the responses were we need more training in emergency preparedness. CHWs should be frontline workers in emergency response, and not just once it happens, but we need to be at the table now planning it. So nothing that surprises probably any of us on this call, but we do have the data to back that.